Well, I guess there were two themes. One was the issue of finance and sustainability and the costs of healthcare, and the other, offsetting that, was the issue of, are we getting something for it? What do we want for it? And so, we shouldn't just say that spending's bad, but you also need to say, what do we get for it? What do consumers want from it? What do we need to change? And what are the trade-offs?
For me, the greatest takeout is that the unsustainability of the current funding of the system. We're simply running out of sufficient tax-paying working people to fund for an ageing population.
Well, the dominant theme is what is the future of our health system looking like? How do we structure it to get the outcomes that we need for Australia? How much do we actually want to spend? Not so much are we spending enough, are we spending the right amount?
I was surprised with the level of unanimity there was today. I think most people accept that government can't continue to fund 70%. I'm sure there was a lot of agreement around the need for a single funder, whatever form that may take, that having a single payer in a system is a recipe for greater continuity of care, more integrated care, more investment in the infrastructure and services necessary to manage care and the patient journey.
Well, in fact, it was surprising how closely aligned a lot of the views were. It's a meeting that tried to stay out of the trees and in the strategy.
One of them is making sure that what providers do, what clinicians do, is the right thing. And that's the right thing is in a number of senses. What patients want and what patients value is part of the right thing. It's what's clinically right, what's evidence-based, what not doing wasteful treatments and doing things in the right ways.
I think it's the silos that we find ourselves with is really the biggest challenge, and the lack of information that transfers in between those two. Just the public hospitals and the general practitioner or primary care areas is a problem as identified by the Health and Hospital Reform Commission.
I think a new government would naturally be more an advocate of market forces, and I certainly believe in that. So I'd expect to see a greater reliance on the private system to contribute towards our healthcare system.
Well, I don't think just because the Liberal government federally and Liberal government at state, they're all going to agree.
I mean, both governments, no matter who wins the election, are faced with this lack of fiscal headroom or lack of finances. Both sides are looking for cost savings. So health reform, I think big bang health reform, the time is gone. Whether the government gets returned or the opposition comes in, they're going to be looking at where are the inefficiencies, where are the duplications, where are the people who are not adding value. And I think both of them have got views about that.
The greatest harm or frustration is that you have so many people with a good knowledge of the healthcare system and the opportunities to improve it who share views, yet we're seeing so little progress in operationalising that thinking.
One of the words that kept coming up more than I had thought about was transparency. The importance of making clear that consumers know what's happening, the importance of changing Medicare, for example, to make clear what the outcomes of care are and so on. So I think that word came up much more frequently than I had anticipated.
If there's one thing that struck me is that there's a universal view that we need a joined up health system with good information. And one way of doing that is to actually say, well, if it came out of a single funding pool, structurally you can help join it up. Public hospitals, private hospitals, community service providers, mental health, community services, we all need to talk to each other.